Have you ever wondered how plastic surgeons correct inverted nipples? The first step in this operation is to make an incision at the base of where the nipple should be. The aim of this operation is to correct the inverted nipple. As you can see, this is a normal nipple and the entire nipple is actually sitting on top of the areola. When you have an inverted nipple, this part of the nipple is actually turned inside out and is actually buried down in the breast. Here we have a cross-section of a breast to demonstrate the abnormal anatomy. So we have the glandular breast tissue in the base of the breast which produces milk. Then we have these milk ducts going up towards the nipple. And in the case of an inverted nipple, these milk ducts are too short and tight, so they're actually pulling the nipple down into the breast, and that's why it's inverted. To correct this inversion, I have to divide all of the milk ducts, and by doing that I'm freeing up the nipple, and then we can pull it back outside of the breast onto the surface of the breast where it should be. Dividing all of these milk ducts means that the woman won't be able to breastfeed because there's no continuity. However, for most of these women, they can't breastfeed anyway because the nipple won't come out far enough to allow them to feed. So after dividing the ducts, this frees up the nipple so it can be elevated back out of the breast. As you can see, there's a defect left here in the breast tissue where the nipple used to be. There is a tendency for the nipple to want to go back in and evert again, so we need to obliterate this defect by suturing breast tissue. So now I'm going to obliterate the defect below the nipple by bringing some tissue together, and I'm going to stitch that together underneath the nipple. By having all this tissue brought together, it completely stops that nipple from wanting to go back in. So as you can see, her nipple is no longer inverted, the skin is closed along this line here. And just remember with this procedure that you will not be able to breastfeed. And it's also a procedure that can be done under local anesthetic in the office.